Welcome back to Girl Talk. We're filming today at William Thomas Custom Jewelry. We've been having a great time. Later in the show, you're going to learn a little bit about why this is your spot. It's been our spot. We're also going to share with you some great information that Janet got earlier this week about some things in dentistry. So tell us what you learned.
Well, I went out to Village Smile Care, spoke with Dr. Angela Cody. They're out in Mount Horeb. And we talked about dental insurance. I know that's not a very sexy topic, but you know how health insurance is so much in the news. It's getting harder and harder to afford, let alone dental insurance.
Yes.
So she's going to explain how more and more dental offices are coming up with their own plans to help us afford dental care. Let's take a look for some Dental Insurance 101. When it comes to visiting your dentist, research has found that we actually fear the bill more than the drill. Today I'm at Village Smile Care Dental Office in Mount Horeb, and with me is Dr. Angela Cody. Now, most of us think it's a smart idea to have health insurance, but what about dental insurance? Can it help with the bills? How does it work?
Dental insurance is certainly helpful, but a big misconception is that it's going to be like medical insurance, and it's really quite different. So as medical insurance usually covers a large portion of your bill, or once you reach a deductible, everything's covered, dental insurance is very different. Usually they just cover up to a certain amount, and those limits really haven't changed in years, so most people have about $1,000 a year to use. And what that means is if you have a costlier procedure, say you break a tooth and you need a root canal and a crown or a dental implant, those treatments can cost $3,000, $4,000, $5,000. Your insurance will pay up to $1,000, and then you owe the rest of that. So it's very helpful. They do cover your preventative services like cleanings and x-rays and exams at 100%, but it's not quite like medical where you can just go in and say, okay, bill my insurance and walk out the door.
Yeah, so it sounds like not only are your teeth getting capped, but your benefits are too.
Yes, for sure.
But you don't need dental insurance. We don't need it to go to the dentist.
Right. So for those people where it's not an option, there's definitely many ways that we try to make dentistry affordable and accessible. There's interest-free financing that we offer, so if someone needs larger treatment, they can space out the payments. We do offer discounts for paying in advance for our non-insurance patients. And our office and many other offices are doing this now, have their own kind of membership clubs where patients can get a discount by signing up and paying monthly and committing to their dental health.
Let's talk about that more. So you have a membership club here?
Mm-hmm.
Okay.
Yeah, so we have a program, it's called AlumaSure, and the patients pay monthly. The advantages of that is there's no limit. So if they want to get $10,000 of treatment done, say they need lots of work, or they want to get orthodontics, which often isn't covered.
So cosmetic stuff is included?
Yep.
Wow.
There's no limits on what's covered. So things that generally aren't covered by insurance can be covered. And also, a lot of times insurance does something called downgrading. So they don't always have the patient's best interests and their health at heart. For example, many people don't like the silver mercury fillings, and we don't really place those typically as much anymore. But the insurance will only cover that. So then the patient has to pay the difference and pay all of that out of pocket. So with our membership program, there's no limitations, there's no downgrades. It can really cover what's best for the patient.
And how does that differ from dental insurance itself for an individual policy?
Yeah, so like I've kind of mentioned, you'll have your yearly maximum, and with our membership club, there's no maximum. There's the downgrades. Also, certain procedures sometimes just aren't covered. Even something that is maybe the best option, like a dental implant, the dental insurance company may say, oh, well, we'll cover just a partial denture, or something removable, not as comfortable for the patient. The insurance is good, and if your employer offers it, it usually is a good benefit and worth your while. But you just have to kind of look into the plan, and for those without insurance, there are other options.
Sure, make sure that you know and take advantage of the free cleanings,
Yes.
that you get with
Yes.
a dental insurance.
Yeah.
So it sounds like your club plan is a little more like health insurance.
A little bit,
A little bit closer to it.
Yeah.
Where can we go if we want to understand a little bit more about dental insurance options?
Definitely ask your dental office. They can definitely help research your benefits, especially some people that are looking into purchasing their own individual plan. Some of those can be great. Some of them have long waiting periods. Like certain plans will make you wait a year to get any advanced treatment. So if you broke a tooth and you think, I'm going to sign up for this insurance, it may not kick in for a while.
They're onto that.
Yeah. Definitely even calling the insurance company and speaking with your HR department at your employer if they have plans, because another misconception is, a large insurance company locally is Delta Dental. So someone will call our office and say, I have Delta, what's covered? each employer picks their own plan, so it varies employer to employer. So just making sure you really know your plan specifically.
Okay, and you can help too.
Yes, we have a great office manager, Amanda, you can call, and any dental office should be able to help you maximize your benefits.
Alrighty, so you can give them a call right here, or even stop in at Village Smile Care in Mount Horeb. We have more Girl Talk right after the break.